to Season 2, Episode 2 of Gone Mental. I'm Kristy.
I'm Andrew.
This episode is going to be about hypnosis and mental health. I've had success using hypnosis to stop biting my nails. I started biting my nails when I was 9 months old. Earlier, at the end of last year, I decided I wanted to become a nail technician, and I couldn't become a nail technician while I still bit my fingernails till they bled. Technically I could, it was just a really bad look.
Yes, very much.
So I tried hypnosis. I had one session of hypnosis that lasted 45 minutes, and I haven't bitten my nails since. I'm really proud, and it's now allowed me to become a Jamboree consultant. See how beautiful they look? You can come buy these nail wraps off me and the enamels and that sort of thing. And
Commercial plug.
yes, commercial plug, and I'm proud because it's my business and I need money. Okay, so we both know what it's like to have our finances impacted by our mental health. So that for me was validation that hypnosis works, and it works very well for me. Now Andrew has become a hypnotist?
Yes.
A hypnotherapist?
Hypnotherapist, yes.
That's the right way to say it.
That's
And I'm
right.
going to ask him questions about it. So as you learn more about hypnotherapy, people practice differently, but Andrew will be focusing on how he practices.
That's right. Yeah.
So Andrew, can you tell us more about what hypnotherapy is like?
I think it's wonderful. It's a powerful therapeutic tool that I think should be available to as many people as possible. Particularly, and my central concern will be with people with mental illness. I think it's a powerful tool that people with mental illness should use, and other people can use it too.
So,
That doesn't answer the question,
No.
does it?
no.
Okay. What's the question again?
What is hypnosis?
What is hypnosis? Hypnosis is a natural state that people drift in and out of on a daily basis. The trick is to control it in such a way that you can help to solve your own problems.
Mm-hmm. So, how do you think that this can help people with a mental illness, Andrew?
This is a huge question. This is my central thing that I'm concerned with. Many people say if you've got a mental illness, it defines your whole life. It can really oppress you. Some people don't believe mental illness exists. Other people think it's just, you are your mental illness. I do not claim to cure mental illness, by the way. Some people do, but I'm never going to go that far. What I say is, let's say you have, like Kristy and I, you have bipolar, you have schizophrenia, depression. Can't necessarily cure, we can manage it, but people with mental illness, it's unusual they only have a mental illness. Very often they have bad choices, they have bad diet, or they smoke, they drink, take drugs, have low self-esteem, and all of these things can be addressed.
Bite their nails till they bleed?
Yes, that's right. Have phobias, have fears, and all of these things can be addressed and even corrected by hypnosis, and therefore improve your whole all of life sort of feel, and then work out how you can better manage your life with just the mental illness and maybe a few less problems.
So you think that sometimes you can get a reduction in symptoms with hypnosis?
It's certainly possible, yes. The way that I practice is I treat everyone as an individual. So it's not just, okay, you're a patient who has bipolar, we will do this, this and this. It's never quite that simple. Even though, for instance, Kristy and I both have bipolar. I have type 2, Kristy has type 1, there's a difference. But for every single person, the way the mental illness affects us is quite different. what really annoys me might be quite okay or quite different for Kristy, might be
Often
different
is.
to someone, and it often is, yeah. So it's the illness is just part of it. It is how it affects the individual, and the individual can say, okay, I find this and this irritating. Okay, we can work on that. We can work on this behaviour. We can work on this feeling. We can work on these particular fears. So we don't necessarily start with the diagnosis. We start with how it affects the individual person. And so what I will attempt to do is to, as a patient, as a client, as a whatever you wish to call yourself, you can come to me. I'll treat you as a person, and I'll work out what you'd like to do, what you're good at. I use a strengths-based approach, by the way. And then we see how you can alleviate some of your suffering, and we'll take it from there.
Okay, I want to talk a few minutes about Andrew's been treating me for anxiety, because although I have bipolar, my bipolar has been really stable and really well since 2012. And I had a minor relapse in 2012, a major relapse in 2011. But I have a great deal of anxiety, and some of it was really triggered badly by recent events. And for me, because Andrew treats me as an individual, he found something that's very personally meaningful for me, and he's used that to put me in a state to calm me down. Because I'm so fond of animals, to the point where I would say my temple is the zoo, and I feel this close connection to animals. I picked the rhino, and Andrew puts me into hypnosis surrounding the rhino. So I'm going to ask Andrew if he will hypnotise me here in front of our audience to show you what it's like when he treats me. It'd be different with you, because I don't think there's that many people who will go, Andrew, can you please give me the rhino treatment?
You might be surprised. Now that you mention it, Kristy, thousands of people may come out of the woodwork and say, yes, that's exactly what I want.
I know that there's lots of people who are very passionate about rhinos. I understand that. I am one of them. I chose the rhino because it was an animal I hadn't been to the zoo to see with my ex-fiance. It was a zoo that I actually hadn't been.
The animal did not have negative connotations.
Yes, it wasn't like I remember all the times that me and my ex went to the zoo to see the elephants, or we went to Adelaide and saw the pandas in Adelaide Zoo. And I love rhinos, and I love elephants, and I love pandas, and that hasn't changed since my ex left. But it was to be specific because a lot of my anxiety was around him. So you need to understand the context, because out of context, hypnotising me to be with rhinos is kind of strange. But it's particularly the wide rhino, or the white rhino, sometimes they call it the white rhino, because that's the calmest. There's two types of rhinos. Rhinos, like me, are a high-strung animal, but the black rhino is very high-strung. So it's not necessarily
The black
good.
rhino is even more high-strung.
Yeah, yeah. So I want to state where I'm more like a wide rhino, which is the calmer type of rhino. I saw a little black rhino run away from a bird when I was at Dubbo Zoo with my parents.
Not a large bird, I take it.
No, it got frightened by a bird, which is something that I would do too, because I don't like birds.
And that's another affinity you feel with rhinos.
Yes.
They're scared of birds.
Well,
Or some of them.
yeah, this one was. But also the white rhino is a herd animal, and I got a lot of support from my family and friends when my life felt a bit, so I felt like I was surrounded by a herd that loved me. So, okay, we're going to stop the preamble, and Andrew's going to hypnotise me in front of the camera.
Okay. Now, you may close your eyes. Kristy likes to close her eyes. I use suggestional or invitational method where you don't have to follow instructions, you just may. So you may close your eyes. Kristy has already had me here. This is going to be an abbreviated session. because Kristy can't wait to be with the rhino. This is something she absolutely loves. She is there already. She's picturing the rhino. Okay, Kristy, you tell us how do you see the rhino? What's the situation look like?
I'm focusing on the rhino that likes to use the cables in the fence at Dubbo Zoo to make notches in her horn. Rhinos like to decorate their own horn however they can. They often use tree branches and things in the wild or ground, or they each have different ways. But this is the only rhino ever at Dubbo Zoo to use the cables on the fence to make notches in her horn. She's calm, she's eating grass, she's surrounded by the other rhinos. Two of the teenage rhinos are off in the distance. They're having a little scuffle, but nothing serious. They often have a little bit scuffle, but nothing serious. Life is really content. There's a lot of peace, a lot of calmness.
Now, Kristy has formed a very clear image of what she sees. I use conversational hypnosis as well, by the way. This is just to explain. Okay, so you're with the rhino, you're on the other side of the fence, feeling calm. Is anything bothering you, Kristy?
No, feel very relaxed.
Feel peaceful? You don't feel even a little bit of anxiety, perhaps? You don't look very anxious.
I don't really feel very anxious. I was excited about taking Mental today. And
Me too.
And I was happy about that. Today's been a good day, and I just love connecting with my rhino.
Okay. Now you continue to breathe evenly. Concentrate on the rhino. As you can see, Kristy is very concentrated on the rhino.
I've also had a lot of practice.
She's focusing on a very positive image, something that makes her feel very good, calm, peace with the whole world. You feel your inner strength coming through that wonderful image. So you can just now continue, gaze at the rhino can gaze back at you, and you can feel that you can even become a rhino for a while if you like. It's up to you.
I always like to invoke the rhino.
Invoke the
inside
rhino,
me.
yes.
And that's a bit new agey for Andrew, but because he can handle other practices.
I can handle it. I can handle invoking. That's fine. Believe it or not, viewers, Kristy is in a hypnotic state at the moment. She's tuning, breathing deeply. She's focusing. And Kristy, you can keep going like that for a little while. Not too long, because we're being filmed, but just a little while longer, and just gently come out of the trance. That's a bit more abbreviated than a session would be, say, with a new patient. I've had practice with Kristy. We've done this several times. And Kristy was very enthusiastic. She loves getting into invoking the rhino. So I didn't need to say very much. She was there almost instantly.
It also helped today that I wasn't experiencing anxiety today. When Andrew first helped me with the rhino work, I was highly in probably the highest levels of anxiety in my life. It was just after Frank had left, I was still scared for my safety. And I was freaking out, paranoid, and it really helped me a lot. I also think that I just displayed under hypnotherapy, because I was able to talk, that you can't be hypnotised to do anything against your will. Isn't that right, Andrew?
It's an example of you can't. That's right, yeah.
Even under hypnosis, you can't shut me up.
Absolutely. Now, conversational hypnosis suits Kristy very well because she likes to talk.
Mhm.
So, yes. For other people, maybe not, but this is a tool in the arsenal.
So there's lots of different ways that Andrew will work with different people.
Yes.
But this is one, and we just thought that actually seeing it rather than just hearing about it might be helpful for some of our viewers. And anything else you want to add to this episode, Andrew?
I think that will do for episode 2. Thank you for listening.
Thank you for watching. Bye.